It's time for more Good Day New York.
As we wrap up the summer, we look back on all the damage we did to our skin, laying out at the beach, at the pool.
I tried to wear sunscreen. Did you?
I did, but you know what? I didn't get too many beach days, so when I was out there, I really wanted to, soak up some rays.
Yeah, do it in, but that's bad.
It can damage your skin big time, and I actually have to really look at this. A few months ago, I visited a dermatologist, Dr. Misbah Khan.
I can't concentrate.
Well,
Dr. Khan, how did you concentrate?
I apologize for the for that, but I have no problem with Dr. Khan. It's the voyeur photographer assistant you have that got out of hand. Dr. Misbah Khan, a Harvard-trained dermatologist, joins us as we reevaluate our skin after the summer. Welcome.
Thank you so much for having me. It's always nice to be back.
What was it like to see Greg without a shirt on?
Stop it.
I'm very professional.
Oh, that's right. I'm sorry, Dr. Khan.
Yes, yeah.
I let my imagination get away.
Yeah, no, but...
Let's be serious for a second. I got a friend named Joshua, and he has an issue with his face. And he's very sensitive about visiting the dermatologist. And I'd like to introduce you to Joshua, if we can, okay? And just make an assessment, if you could. I know it's on television.
Oh, stop
That's
it.
Joshua.
Oh, wow.
What do you think?
I think for what Joshua's aiming for, this looks a pretty good look.
All right, Dr. Khan.
That's a blowfish, by the way, I think. All right.
Let's get serious, Dr. Khan. Okay, the summer's over with.
Yes.
People put away their sunscreen, which they shouldn't, right?
Yeah.
Because you should wear it year-round. Is this a good time to kind of assess the moles and beauties?
It's a very, very good question, and I think that once the summers are over, or any time throughout the year, it's very important for patients to bring it to the attention of their doctors if there's anything new or changing that they might have noticed. And that does not necessarily include the moles or anything, but also new spots. A spot that does not heal. For example, if it bleeds easily whenever a patient, if it's a male, if they shave, or if it's a female, let's say they think it's a pimple and they pick at it and it keeps coming back at the exact same spot. Those are the spots of concern. So bring it to our attention. Many times, a clinical evaluation is all we need, and treatment is very simple.
And
you have
a special instrument that you use.
I do have a few instruments for the non-diagnostic skin imaging that we use in our daily practice, so we can use those. And many times, if a clinical evaluation is not enough, a small sample of the skin is all we need to just establish a diagnosis, whether it's a cancer or not. If it's caught in its early stages, the treatments are very simple, easy, sometimes even non-surgical. If you let it go, then yes, surgery is going to be the treatment. Sometimes it can be a little bit disfigurement involved after the surgery is completely, done and everything. So it's better to catch these things early on.
What about Greg? Is he okay?
Greg is great. We found one mole on his abdomen that I biopsied, and I think that it showed pretty much all A, B, C, D, E that we look for in a mole. A being your asymmetry, the borders were a little bit jagged, the color was a little bit irregular, the diameter was pretty large, and then also it may have started as a normal looking, or which the biopsy showed, but it evolved into something which was abnormal.
How far did you go down, Dr. Khan?
It was a body exam, all right? I mean,
just checking.
Listen, doctor, though, I learned something interesting from you. Just let's say we get evaluated because we were at the beach too much this summer. The damage we did this summer may not be evident for decades from now.
That's a very good point. It's cumulative for the most part. Unless you have a predisposing condition, let's say if you have a medical underlying condition that brings your immune system really down, those are high-risk patients. Then the damage can be a little bit more apparent. But for a healthy individual, whatever damage you do to yourself today, it will not show for years to come. And whatever damage you did for yourself years ago may be the one that's appearing right now.
Wow.
So it takes time for all the skin to recover from all of this.
And sunning, as much as I love it, it causes aging, right?
It definitely does. Sun is one of the known factors for aging, for photoaging. And then, there are other things also involved, like your gravity, your genetics, weights ups and downs, your daily lifestyle. All of these things, they add up. And every little bit helps.
I see you brought like some kind of little instrument.
Yes. So
what is that thing? It looks like a pitchfork.
Yes, it is actually a handcrafted instrument that I use to determine a patient's facial profile. And this is not necessarily for medical purposes, it's more of a cosmetic thing. So this is called as a golden ratio caliper, and it measures and it opens up exactly to the golden ratio, and the golden ratio is what defines the different proportions of our face. So as we age, I basically break the aging process down into 4 Ds. So number one being the descent which happens because of gravity.
Right.
Then there's deflation, which people, they lose a little bit of a facial volume. And then there is distortion, and then also deformities that underlie along with it. So all of these put together, when you examine a patient's face, you say, okay, you know, what exactly is the most predominant thing that we're working with? Is it just a deflation? Is it just a descent? And then that's how you determine the plan.
So you have before and afters on what you do. Can we see some of them?
Yeah,
Let's see
absolutely.
a before picture.
Yeah. So
tell us what's, you know, what were the issues with this person?
Yeah. So let's just pull up that picture.
Yeah.
So while we're
waiting, you've got a great bedside manner. I got to tell you, you really got a great touch. All right, here, what happened here?
Here's our wonderful patient. So let's, for the sake of the segment, let's call her Amber. So we see, I saw her as looking at her before picture. So it shows pretty much all the signs of the aging that we were talking about.
She looks like how old is she?
She's in her late 60s.
Yeah.
So we're looking at, there's a lot of descent, there is a little bit of a deflation of the face, and a lot of the crowding is occurring in the central part of the face, and this is normal part of the aging, that as we age, the face turns from more of a triangular shape into more of a cylindrical shape.
So what did you do to help her?
So this was a combination of different things that we had to do for her, because there's so much skin laxity that if I try to blow her, like inflate her, then the picture of the face will actually fill up the whole screen, and that's not the point.
Oh, we don't want that.
So,
let's see the after picture.
So the after picture is that I had to excise some of the excess skin in her case, and so I did a little bit of a mini facelift on her, and then I took some fat from the thighs, and then I recreated the proportions of her face.
Oh, I see.
And then after that, I actually also did her resurfacing with the laser to get rid of some of her acne scars and sun damage that she has acquired over the years. So that actually led to a much youthful looking face, and that ended up being very proportioned altogether.
Well, Dr. Khan, I have one question for you. Is the skin an organ? We used to have this thing.
Yes, it is the largest organ of your body.
Is it really an organ?
It is an organ, yes.
She went to Harvard, she knows.
I understand that, but it just, we don't think of it as an organ. We think of the heart as an organ, or a liver.
Skin is the largest organ. It is a very important part of your body.
Why did you pick it? Why did you want to study the skin?
That's I think skin picked me. I believe that, and I think that the reason why that happened was because I had significant skin issues when I was growing up, and I think that nobody could figure it out, and then until I went to medical school and I found out what was wrong with me, and that was that I have really bad case of eczema. Myself, and I've been dealing with it since I was 3 months old, and I cannot be in the sun at all. It excites the eczema and the rashes and everything, and for the longest part, my parents didn't know what was wrong with me. So until I went
to medical school, you figured it out yourself.
I figured it out, and then now I help a lot of people and a lot of kids, and I know what they go through.
She's sensitive. I like that.
Dr. Misbah Khan, K-H-A-N.
Yes.
Google her. She's in town here in Manhattan. Thank you so much.
Thank you so much for having me. Thanks a lot.
All right, we're going to meet Kathy Hilton next. Kathy Hilton, mother of Paris.